I would like to discuss with you the non-surgical facelift, the minimally invasive thread lifting and combination therapies. My disclaimer is that I have financial relationship with and may benefit from the promotion, sale, or the use of the Ultra V thread products. We touched on the regenerative medicine plan, and here we're gonna go deeper and deeper in the collagen biostimulators, the face, neck, nose, and eyebrows threads. So who has had thread lift from celebrities? Angelina Jolie, Nicole Kidman, Sarah Ferguson, Eva Mendes, and more celebrities and more celebrities. In my experience, only 10% of patients will prefer to have surgical facelifts, but 90% would prefer a non-invasive approach. So we will discover that behind the thread lift we know today has been great efforts from amazing specialists, dermatologists, and plastic surgeons. So let's see what the evolution of thread lift is. Dr. Patrick Tracy, his work in facial thread lifts and other cutting-edge cosmetic treatments has earned him numerous accolades and widespread respect within the global medical community. I have met him last year at the CosDoc of the College of Cosmetic Physicians, and such an amazing man. In fact, he won the Doctor of the Year in the UK and Ireland in 2018. He was awarded the top dermatologist aesthetic practitioner in the world in 2019 at My Face, My Body Global Awards in Las Vegas. The history of threads has started seriously during the 90s, and it has evolved as we know them today. In early 2000s, two doctors, the Russian Marlon Salamanidze and the French Pierre Fournier, they published papers introducing a new type of facelift using barbed threads, entitled Removal of Facial Soft Tissue Ptosis with Special Threads and Facial Lifting. And they used the antiptosis and call it aptos. So in here we see the family of the Salamanidze, the father and the two sons, Marlon, George, and Constantin. And we see also Dr. Pierre Fournier. And they created the thread made of 2,0 polypropylene suture material with fine barbs cut into it in opposing directions, specifically designed for facial aesthetics. These threads were designed to be implanted to the subcutaneous tissue via a special spinal needle in various direct patterns, mainly focused around the mid-face, but also they elevated and raised the eyebrows and the neck. These original mid-face patterns were designed to create or recreate the malar fat pad, to reinforce the malar fat pad and then to lift it. While straightforward, the modality requires significant manipulation to force these large spinal needles around the curves. They come from the temporal space and insert the thread throughout to the malar fat pad. And then Dr. Wolfswu in Singapore, he realized that he needs to anchor these threads somewhere to a firm immobile tissue rather than in the mobile area of the superficial fat. So he began working on a similar modality that would require fixation of his threads to deep fascia. And in 2003, the Australian firm Austramedics brought Dr. Salamanidze to Australia to help educate Australian doctors in the aptos procedure. But during his travel to Australia, sorry, in Sydney, in EPRAS in 2003, Dr. Wolf Wu presented his technique. He encouraged to call it the Wolf Lift, and he changed the name to WAPTOS at that time. So Dr. Salamanidze, Dr. Wolf Wu, and Dr. Nikor Issei from California, USA. He's an endoscopic and bra lifting specialist, and he also designed his own threads. So in 2004, he inserted throughout the temporal incision and followed the superficial fat from the temporal down to the mandible, then tied off in pair of deep temporal fascia. This product was purchased by US company Surgical Specialty. So they called the lunchtime procedure or the lunchtime facelifts, but it had lots of complications. It was prickling and tingling, and there were temporal extrusions and mid-face extrusions, intraoral extrusions, and this happens many, many years after the procedure itself. And as you can see there, they're removing the extruded threads, which happens to be in this patient for 18 years. And in 2010, Dr. Shiro Accardo, he created the Proma Italia. And the Proma Italia is the first absorbable suture material. He focused on smaller barbs, then there is less force of the surrounding tissue will be, and therefore the risk of peeling will be reduced, peeling of the barbs of the actual threads. Absorbable material meant that even if the barb did manage to peel over time, the product would absorb and eventually be phagocytosed and therefore reducing the risk. Now, the free-floating microbarb threads stimulate the skin fibroblasts to make collagen support, rejuvenation, and rehydrate the skin. Dr. Nikor Issei, along with his father and son engineer, they were discussing how to achieve the desirable results that threads lifting and overcoming the complications. And while the son was playing with a gun, he extruded a cone accidentally. And from there, the cone has become another new advantage. These cones will be held placed by knots tied to the suture material. And it was an added advantage that it doesn't weaken by cutting barbs into the thread. And it would be good that the fibroblasts will wrap around the cones at 360 degrees, creating fibrosis all around it. And within the cone as well, that will increase the stability of the cone in the tissues. It's very important about face thread implantation to know the actual superficial fat pads and to understand that the weakening of the ligaments, retaining ligaments, and that will add to sagging of the cones, and we're reversing that by anchoring the threads into the superficial fat pads and lifting to a much more denser tissue material. Between 2010 and 2020, then there were rapid progression of all these amazing scientists and surgeons and cosmetic physicians to create a more practical and safe threads. So the thread is actually inserted to go into subcutaneous tissues. And it's very important that you know the depth and the precision of what depth of the thread, and you feel it in your hand that runs smooth without doing any injury of any of the structures beneath the skin. And you can see here the silhouette soft, which is cones and knots, and the first barb thread, which is the Aptos threads. So following the success of Aptos, PDO threads become an innovation. They were made of PDO, that stands for polydioxanone. It's a biodegradable product. It's used in medical sutures usually. And they are preferred for their safety, biocompatibility, and ability to naturally dissolve in the body over time. They provide a more subtle lift and used to stimulate collagen production in addition to lifting skin. And from there on, there were the mono threads, the cog threads, and the screw threads. The mono thread, they're just straight threads without barbs, and they're usually there to primarily used for collagen stimulation. The cog threads have got barbs and provide a mechanical lifting that effecting by hooking into the skin. The screw threads, they're threads designed to give volume to area like the cheeks. And between 2010 and 2020, there are availability of these are the normal tornado, screws, and cogged threads. So thread lift is between the cosmetic or plastic surgeon facelift and the dermatological procedures conducted by energy-based devices, including fillers, and with a natural minimal downtime with great results. So the PDO are threads that are pulled in designated lifting direction. They anchor to the skin, and you can lift them, and you can actually put a knot to stabilize the threads where they are required to maintain the evenness and the symmetry of the face. So types of threads, they are mechanical lifting, minimally invasive. They give us the younger and naturally looking results, quick procedures and recovery, collagen stimulation, and customizable and versatile. The difference between the three main types, the polydioxanone, the poly-L-lactic acid, and the polycaprolactone. The longevity varies between 6 months for PDOs to 36 months with PCL. They are all biodegradable at that time. They all collagen stimulation. Inflammation will increase depending on the longevity of the thread. The elasticity is highly elastic at the PCL and the less elastic for the PDO and PLLA. Safety, they are both same safety profile. The cost gets more expensive, and they all give us the immediate results, immediate tightening, but there's gradual collagen building over 2 to 3 months for the PLLA, over 3 to 6 months for the PCL. And they can be repeated anytime. They can come back to top up this area that needs a bit more lifting, depending on if they sleep on one side or any unevenness can be added whenever is required. So the facial threads have dual action, an immediate mechanical tissue reposition, and then a gradual enhancement. And this is by tissue regeneration and stimulating natural collagen production. The mechanical effect, this is the silhouette soft, the cones, and how they are lifted, repositioning soft tissues, and fixate the suture to rigid tissues, which is in the scalp. And the cone will fix itself, it's unidirectional. It can lift by the base of the cone, and around that, the fibroblast will anchor it to the tissues themselves. The tightening of the sutures, where the knots are there, allowing to accommodate the movement of the tissue, so you end up with no wrinkling and with no puckering of the skin. So The progress is important. How is the healing and regeneration? From day one mechanical trauma, there is damage and necrosis, there is hemorrhage and disintegration of fatty tissue. It's not really hemorrhagic, but obviously it's some trauma to the tissues. From the 3rd to 7 days, there's macrophage-like, fibroblast-like cells, and then by day 7, proliferation of fibroblasts and formation of new blood capillaries. After that, they will form a fibrous capsule with abundant and dense collagen fibers. The increased capillary vasculature is very important, and the theories behind that is increased eosinophils, eosinophil-induced fibrosis due to increased release of histamine. Wound fibrosis continues and with dermal to skeletal muscular tissues, and these are a theory by a neurologist. It's called the connective tissue matrix single transduction theory. So the collagen plays a vital role in the aging process. The collagen, it's the most abundant protein in mammals for about 70% of the skin. There are 12 types of collagen in the human skin, but we're only interested in type 1 and type 3. So the collagen is essential in the interplay between skin cells, so it plays major parts in communication between fibroblasts and keratocytes, and as the extracellular matrix for elastin, hyaluronic acids, and water molecules. So between type 1 and type 3, the regenerative and the protective, they are, the difference is eventually is this is loosely packed as a protection and then become dense and with various diameters, bigger diameters for this dense effect of regenerative power of the skin. So PDO thread stimulates collagen type 1. The type of collagen is the most abundant in the skin, which is type 1. It is it's strong and elastic. Initially the PDO promote type 3, but eventually it will all gonna change to type 1 over time as the skin matures and strengthens. So the science behind embedding threads under the skin is about skin rejuvenating effects. Very important, which you do not get from surgical facelift. Surgical facelift is great, but it looks a bit, change the face, it looks fake. Because the direction of lifting of the face is diagonally behind the ear. So you're changing the face dynamics. But thread lift will reverse the aging process in to reverse the descent of the fat pads. There are 3 processes for the rejuvenation: is promotion of local microcirculation, activation of the repair process, and stimulation of collagen production. So the threads, as we discussed, acts as cogs to grasp, suspend, and form like an umbrella to support structures and then lift the sagging skin. This is the histology of showing collagen deposits around the threads and the knots. The possible treatment area is the face, forehead, mid-face, jaw line and nose, eyebrows, the neck by tightening and lifting, specific areas of the face, glabellar fold, crow's feet, nasolabial folds, and the fine wrinkles. The alopecia, they discovered now by increasing microvascularity around the hair follicles, it can be helped. And be very careful about firming and shaping and lifting the breast. So this is my patient before and after about 3 months. Looking at the neck and the nasolabial fold, the cheeks, Apologies for the lack of precision in these photos and the actual lighting. But surprisingly, 3 years later, it says here 2 years, but I can assure you 3 years later, she looks like that. And obviously she had other treatments. She had vampire laser treatment, fractionated laser treatments, but the rest is the body collagen formation. So facelifting has got many meanings. Rejuvenation and younger, improve the sag, improve the wrinkles, the folds and the marionette line, and we reversing the aging by regaining our facial shaping. Triangle, the V-shaped triangle. The combination for facelifting, we can use the Ultra V and neuromodulators. It can be by laser face, sorry about the typo, tightening. The Ultra V lift with filler, with fractionated erbium YAG, with biostimulators, Caltra, Radiesse and Elancé, with CO2 Fraxel, and with PRP and fat grafting. The periorbital region is very important to understand how can we rejuvenate it. The most important area to rejuvenate, in my opinion, is the periorbital region, because people look in the face. They talk to you, they look in the face. Your eyes and the face reflects how you feel. So the super tornado, the inch, and the first invented by Dr. Kwan, which is the 1 inch vertical and horizontal in the upper and lower eyelid, the RF cannula, the collagen boosters, and the platelet-rich plasma. So the periorbital treatment, it depends if it's upper, lateral, or lower. The upper, we got the plasma threads and laser, smooth eye laser by erbium YAG. The lateral, the air shine, air dissector threads and the air jet. And then the lower eyelid is the RF cannula, again the collagen, the plasma, the threads, and then the smooth eye laser. So in search of the best threads, evolution and improvement of the threads we have, as we know it now, they must have strong anchorage, strong product, not weakened by cutting barb through it. They're easy to use, minimal downtime, minimal complications, migrations, extrusion, and tethering. They're long-lasting, but not permanent. It grasps mobile tissue and anchor in immobile areas. Great work, great progress by amazing doctors. Threads are my passion. It's the best thing I like to do as a non-surgical cosmetic work. Patients are very grateful, and patients, they're yours and become believing in you because of the sudden transformation. And it doesn't stop there. It keeps going because they want to maintain their face. You have the right buyer, the right quality of patients that would like to enjoy the way they look. They love their face, and we want to help them to maintain that as long as we can, to give them this glow, freshness, attraction. So it's, in my opinion, the greatest tool we can use and to enjoy and get and improve at how we can deliver it, how we can be the artist to understand where exactly the lifting points that will give us great results. It takes some time, but this is my role to lead you to understand where are those lifting points and how we can anchor with great efficiency and the least complications. So it would be great to continue our journey together and learn from me, and I learn from you, from your experience of how we can improve and increase our ability to be able to serve and help our patients.